Hello, my name is Dr. Anand Sinha. I am a pediatric surgeon and pediatric urologist at Fortis Memorial Research Institute, Gurgaon, and I take care of all the urological needs of children from the age of first day of life to 18 years of life. I am going to talk about a condition which is seen very commonly, in which the urine that comes from the kidney into the bladder normally should not go back towards the kidneys, but in some children there are valves which are normally present to avoid this, but they are weak in some children and the urine from the bladder can go back towards the kidney. This condition is called as a vesicoureteral reflux. It is fairly common disease. Fortunately, a lot of children can get resolved with age without any treatment. Sorry. But some children do require a surgery to reconstruct these valves. Now, these are extremely critical surgeries because you need to do them at a proper time to avoid any damage to the kidneys. If you leave them like that and this reflux is not improving, they can damage the kidneys permanently. You can then require kidney transplant also, and we want to avoid that at all costs. So for such children, we have to create a valve from the patient's own bladder. We can do this again in three ways: an open surgery or a laparoscopic surgery or a robotic surgeries. There are various approaches where we can go through the retroperitoneum, that means from behind the bladder, or we can go through the bladder, which is called as vesicoscopic. We also do, in mild cases, cystoscopic injection of some bulking agents like Dexel or Deflux as it was earlier called, which improves the reflux without any surgery to make the valves in milder cases. So all these conditions are treated by us, and it takes a lot of expertise to handle children with care. Every child's need is different. We have to tailor our surgery requirements because of it. And a very important thing is that we have to rule out that there are no other associated causes which lead to this vesicoureteral reflux or urine going back from the bladder towards the kidney. One very common cause that we see in boys is posterior urethral valves. Now these are the valves which block the urine passage from the bladder to the outside, and they are present since birth. You may not notice it. In some children it is noticed at birth. In some children it may be noticed even when the child is inside the mother's tummy, and in some cases they may come very late to us. These children have reflux of urine going back towards the kidney, and their kidneys are damaged if we don't treat them at proper time. The treatment involves just putting in a scope into a child's urethra and removing that blockage. At our center, we have the equipment to deal or do cystoscopy even in a 1.5 kg small baby and give very good results with that too. Again, it takes a lot of expertise and experience to handle such cases. And another such condition is neurogenic bladder, in which our spine is not properly developed. So the nerves which are coming out from the spine are not normal. Our control over the bladder is not normal. So we are not able to push the urine back, urine into the urethra outside. So the urine then starts going back towards the kidneys. Some of these cases also require increasing the size of the bladder, which is called as an augmentation, in which we use a small part of intestine or stomach to make the bladder bigger, so that the bladder also is well maintained. So these kind of conditions require a specialized center with a dedicated nephrologist, dedicated pediatric nephrologist, pediatric urologist to handle such cases and to provide excellent results.